The committee found that over the past 10 years, there has been an increase in the number of reported concussions, and this could possibly be due to an increase in awareness or reporting of concussions by athletes. However, we do not know the true incidence of concussion, as several concussions go unreported, as well as the lack of consistency in terminology with different studies that have reported different definitions of concussion, as well as different athlete exposures that were used in those studies. The committee found that the majority of research on the epidemiology of concussions is at the high school and the collegiate level, with very little to no data that has been reported younger than the high school level, as well as on club sports and competitive and recreational sport settings that are outside of the academic setting. The committee found that recently there has been a shift in the incidence of concussions, where there are more concussions reported at the high school level compared to the collegiate level, specifically in sports of football, men's lacrosse, soccer, and baseball. When we looked at differences in trends for the incidence of concussions, we found that there is a higher incidence of concussion in competition compared to practice, except for cheerleaders who have a higher incidence in practice compared to competition. Concussion rates have been found to be higher in female athletes in comparable sports to males. Therefore, female athletes in soccer, basketball, ice hockey, softball, and baseball have a higher incidence of concussion compared to male athletes. We have found that there are certain sports that have a higher risk. This slide is in no particular order of sports that have the highest risk, and the majority of the literature comes from high school and collegiate athletes. For male sports, the committee found that the higher incidence of concussion have been found in ice hockey, football, lacrosse, wrestling, and soccer, while female athletes have a higher risk of concussion in soccer, lacrosse, basketball, and ice hockey. The committee found that when we looked at the incidence of concussion, there is no consistency and there's pretty much no data that is collected on race or ethnicity. And if potentially there are differences in race and ethnicity, it could be possibly attributed to social economic status, to cultural or psychosocial differences, to education or lack of health care. The committee found that there is no published data on the incidence of reported concussions during basic training for military recruits. In 2012, there was approximately 26,000 concussions, or MTBIs, reported in military personnel worldwide. Out of these 26,000 concussions, or MTBIs, it represented 85% of all TBIs in military population. In addition, more than 80% of TBIs in military do not result due to deployment settings. The majority of concussions, or TBIs, in military personnel are due to motor vehicle accidents, falls, sport and recreational activities, and military training. Therefore, the committee's first recommendation is the CDC should establish and oversee a national surveillance system to accurately determine the incidence of sport-related concussion in individuals aged 5 to 21. The surveillance system should include demographic information such as age, sex, race, and ethnicity, pre-existing conditions such as learning disabilities and ADHD, individuals who have a previous history of concussion and the time that their concussions occurred, as well as the use of protective equipment and impact monitoring devices. And finally, surveillance systems should also include the qualifications of personnel making the diagnosis of a concussion.